More session of YouTube live. Now, as monsoon sets in, we had torrential rains for about 4 days, and after that, there had a lot of cases of cough, cold, and coryza. So, of late, there were a lot of remedies, which we think about, like for cough, cold, coryza, Hiparsulf, Restox, Bryonia. But there were some remedies, there were some cases where the so-called remedy which we give routinely did not work, and then we have to think of something else. Recently, last week, a patient came to me, and the patient had a lot of cough problem. Here he was a homeopath himself. He had taken few medicine, but there was no change in the patient's cough. So he came to me. And he said the cough is very, very dry, very, very dry cough, especially during night. And my neck becomes stiff. My neck becomes stiff. And he said the cough is very dry, especially at night. It is very raw and the mucus is dropping from the nares. And the neck becomes very stiff. He had taken remedies like bryonia, arsenic, it did not work. And now, if you open the Mater Medica, in Boric Mater Medica, if you open Sticta pulmonale, the introduction part, it is written rheumatic stiffness of the neck and cough dry during night, worse inspiration and rawness of throat. He had already taken bryonia, causticum, Hiparsulf, nothing worked. So I gave the patient gave the patient Sticta 200, 3 doses, and told him to report after 24 hours. He called me on the phone and said cough is 80% better, no cough. In fact, he had suffering from stiffness of the neck for a long time. That was also much, much better. And he asked me the remedy. I told him Sticta. And he was surprised at how Sticta he did not prescribe in spite of he being so knowledgeable in Mater Medica. So my dear friends, apart from routine prescription, if you want to understand Mater Medica, if you want to understand homeopathy, it is important to have a good look at the Mater Medica of cough, cold and coryza so that you do not miss any remedy. One more case I'll discuss before going to the questions, okay? I had a similar case, of lot of cough. There was a lot of tickling in the throat and a lot of dry cough. Because of the cough, the patient could not sleep. When he slept, again the cough started. He could not lie down. Rawness of the trachea, the throat and the larynx. And he could not speak properly. There was a lot of soreness in the chest, especially in the sternum. There was sensation as something was there in the throat. So with the modalities of lying aggravation, very dry cough, barking cough, and pain in the throat, the obvious remedy which I prescribed the patient was hyoscyamus. I gave the patient hyoscyamus and the patient came after the next day in the evening. He had no change. He said the cough is as it is. Again going to the Mater Medica, I again read few remedies and I came to Rumex crispus. If you see Rumex crispus, all the symptoms are mentioned in Rumex crispus. That is aggravation by talking, tickling in the throat, rawness of the larynx, soreness of the chest, dry teasing cough, which prevents sleep. Now, prevent sleep and aggravation on lying down are so close to each other. Sometimes because we are in a so hurry that okay, lying down aggravation, we have the remedies, have some XYZ, we prescribe the remedies, no change. So dry cough preventing sleep, I prescribed the patient Rumex crispus 200 and within 24 hours the patient was much, much better. So welcome Dr. Nitin, Dr. Jugal, Dr. Bharat, Dr. Passion, Dr. Murtuwani, yes. Okay, so I was just telling my symptoms and that's why I could not see that you were online. Now one more question, empty feeling even after eating, which medicine does have this? See, when you are prescribing, empty feeling in the stomach, there are a lot of remedies. Empty feeling in the stomach, there are lots and lots of remedies. If you give, if you tell me something more about the symptom, I will be able to give you a precise remedy. Otherwise, empty feeling in the stomach, not ameliorated by eating. Okay, write down the remedies. First is phosphorus, second is lachesis, third is lycopodium, fourth is sepia, and I think senna is also there. So these are there are a lot of remedies. Only if this 5-6 remedies that comes to my mind. Veratrum is there, I think Merck Sol is there, Staphylos aureus is there, lot of remedies. So when you are prescribing on the symptoms, make sure that you have at least 1 or 2 or 3 or 4 symptoms which individualizes the patient, so that you can come to 3 or 4 remedies on the repertory chart, and then you can differentiate from the Matra Medica and prescribe the patient. Okay, good afternoon, Dr. Motomani. How to treat edema with dyspnea in a patient of CKD where Epis digital is not working? Very important question, very, very interesting question. Normally, if a patient comes to me with a dyspnea, okay, the patient has a lot of dyspnea problem, cannot breathe problem, make sure that if the heart is involved or not. If the heart is involved, because there is a lot of, if there is a CKD, water retention, so there is heart is involved, the first remedy which I would think is ill serum. First remedy which I would think is ill serum. If you open the Matra Medica, and I think it is, the name is given Serum Anglium, SERUM. There is a fantastic line that I will never forget in my life. Whenever the heart and kidney are involved, ill serum has the perfect action. First remedy you should think about ill serum. I have never used Epismel nor digitalis in this case, because Epismel has a fantastic symptom. If there is edema, there has to be inflammation, there is a lot of pain in Epis mellifica. Okay, so think first about L serum. Second, there is one more remedy you should think about is Solidago. Only if there is lot of water retention, the patient needs a catheteric action, think about Solidago. Third remedy, which is a constitutional remedy and which has worked in many cases of mine, I normally think about Lycopodium. Acute remedy, again I would think about Adonis vernalis. Okay, and believe me, I have got a lot of cases, very good results with CKD cases. Manage the acute and then manage the chronic. If you manage the acute first, the patient gives us the breathing time, then give the chronic remedy. In LM potency, I have found it very useful in my practice. Okay, kindly tell more burdens for lack of energy and feeling of sleepiness over the day. I think this is a case of especially, Nitin, anxiety, depression, stress and all. So make sure that you find out the cause over that. Ill serum 0/3, no. Normally give ill serum 35 drops in half cup of water, 1 spoon of water every half hourly, it will work. Okay, ill serum I give that way. And think about Lycopodium, think about Adonis, think about Calcarea, think about Apocyinum, think about Solidago. These are very, very interesting remedies for CKD cases. Anxiety better by sleep and eating, empty feeling in stomach even after eating, despair of recovery, yes, very nice, feeling of committing suicide. So now we have at least few symptoms where we can think about which remedy to give. If you have seen what remedies I have told you, add to that this symptom of despair, add to that this symptom that recovery will be a problem, and then you'll automatically get the remedy. You have 3-4 remedies which are very, very close in this case, my dear friend. First is arsenic album, second is argentum metallicum, third is antium crude, and fourth is sepia. Frequent urination problems, sir, have some UTI also, but take lot of antibiotics, but frequent urination problem is not solved. My age is 24. Please help. See, Sakshi, the most important thing in your case is frequent urination a disease part, first of all. If you are getting frequent urination, and urination is no problem if you can get frequent urination, unless you are suffering from a secondary problem, we can't stop the urination, unless it is creating a problem in your body. You don't have remedies to reduce the urination unless there is a pathogen involved. So I think if there is an infection, then we can think about something more, okay? Or you can say there are a lot of remedies where it is said that patient passing lot of clear fine water. You can go into that rubric and you can get a lot of remedies. But first of all, you have to understand what are you treating. See, that is very important. What are you treating? Otherwise, there are remedies. There are symptoms: watery urine, clear as water. Then you have remedies like gelsemium, ignitia, sepia. I had a very interesting case where I prescribed squilla. In fact, the patient came for pain in the soles. You have in squilla pain in the sole of shopkeeper girls with this problem. So I prescribed on the pain, and this also was better in this case. So this is how you have to approach a case. Apocynon in which potency? 30 potency, Vishaka. 30 potency. Depression, that's what you have to find the cause of depression, Dr. Nitin. Is going every hour yet clear. Yeah, then you can take some other concomitant symptom, Dr. Sakshi, and think about the remedies which I have told you. You can add phosphorus, phosphoric acid, thuja, teucrium, causticum. These are also the remedies you can think about. Okay, so I think my doctors who are attending my clinic are writing what I am telling you, the remedies, so that there is nothing is missed. Okay, so because I am very fast in speaking sometimes. Yeah. So thank you to all the doctors who are with me. In general, which medicine works in extreme sleepiness? See, when you are prescribing only for sleepiness and extreme sleepiness, the first remedy that should come to mind of all homeopathy. In fact, I had an interesting case of menstrual problem. The patient had a lot of bleeding because she had taken some hormonal pills in the previous menses and the bleeding had stopped. She stopped after 5 days. Then again the bleeding starts. And she took irigeron, she took millefolium, and nothing worked. When my friend called me, it's a wife, and she told, the patient told that, Bhaiya, because of bleeding, I'm feeling a lot of sleepiness problem, Believe me, I prescribed Nux Mosqueta 200. In the evening, in 6 hours, she called me, Bhaiya, it is 80% better. Now, Nux Mosqueta has no relationship with menses, so much bleeding. Irigeron, millefolium, thalaspid, trillium failed. Nux Mosqueta cured the case. This is the beauty of homeopathy. That's why I always tell you, if you have a main symptom and you have a lot of remedies, find out what are the symptoms associated with that symptom of the patient. In this case, it was Nux Mosqueta that cured the case. So, general sleepiness, think about Nux Mosqueta, think about opium, think about Kali Ars, think about Chelidonium or Causticum or Cannabis indica, lots of remedies. Okay? In general, which medicine? Okay, so there may be some questions which have been scrolled up because my assistant doctor is writing the remedies, so I cannot tell you what is. If you feel I have not answered a question, you can again write down. Now, if you see the sleepiness rubric or sleepiness in Mater Medica, one patient came to me. He was suffering from severe gastritis problem, recurrent. In fact, you can tell he was suffering from irritable bowel syndrome. And the symptom, I gave the remedies, it was not working properly. Then he gave me a very interesting symptom, He said that whenever I eat food, I feel very sleepy. Whenever I eat food, I feel very sleepy. So the case was not going according to my expectation. So I tried to repetize this symptom. And if you see in the repertory, Sleepiness after eating, the remedy is laxasis. It is a constitutional medicine. I prescribe laxasis 30, after a week 200, and the sleepiness to went only, but in fact the IBS, the irritable bowel syndrome the patient was suffering from, was also much better. So I hope you understood this. If you understand my answers, do write down on the chat box. Give me some indication that you are understanding. Otherwise, I always feel that I am talking to the computer. Okay, there is no response. So as we go forward, so the case which I was discussing, I hope you got the case. Yeah. So you can ask the question, very fast, so that I am able to. Yeah, there's one question. Medicines for ganglion cyst on joint of left knee of foot. See, whenever you are prescribing, whenever the word ganglion comes, the first thing in our mind, there are 2 or 3 remedies which are very common that comes in our mind. The first is rota, the second is calcarea floor, the third is silicia. Okay, and most of the time we are stuck to this prescription. Okay, done. If you prescribe this and you don't get result, then you have to go forward. Then you have to think of remedies which we never think about. My dear friends, so I hope you can hear me properly, everybody. Yes, you can hear me properly. Okay, so the remedies which you must think about in these cases where this remedy does not work. First, in my practice, I have seen plumbum metallicum. Second, kali carb. Third, sulfur, and fourth, thuja. Of course, keep ruta, calcarea floor, silicia on the top. Normally what used to happen 10-15 years back, a case of ganglion or cyst used to come. We used to give ruta and then give silicia in trituration, 6x potency, and then we used to give repeat. Then if there is no change, then I started studying Mater Medica properly and got this. This remedy also works fantastically. Plumbum metallicum, phosphoric acid, sulfur, thuja. There may be other remedies also, but I cannot get it now. Depression towards extreme. Yeah, see, basically, Nitin, depression's symptom is sleepiness. You don't want to get up, you don't want to go out in the sun, you don't want to get up in the morning. I always tell you there is a cause of depression. You cannot hit in the dark and if it works, it works. No. Once, twice you can think of hitting in the dark, but then ultimately you have to find out, what is the cause of depression, and then you can prescribe. Okay. So my suggestion would be this. Try to find out the cause is very important. You can't get depression or sleepiness like that. You have to find out the cause, and then you can understand which remedy to prescribe. Okay. For example, I had a simple case where the patient had sleepiness with nearly all complaints. He had cough with sleepiness, he had pain in the abdomen with sleepiness, he had pain in the hand with every complaint with sleepiness. That is also Nux moscata. In that case, Nux moscata failed. Then I prescribed the patient a simple remedy, phosphorus, which cured the case. Hello, are you with me? In today's practice, when there is a lot of rains and monsoon has come, sleepiness with cough, the patient says, since I had cough, I am feeling so sleepy, I cannot go to the office also. Think about antiemtad, think about ipecac, think about creosote, my dear friends. Creosote. Of course, Nux moscata would be there in that also. Okay? Are you with me? Hello, everyone? Are you with me? Are you understanding, everyone? This is the importance of knowing the Mater Medica, the associated symptoms, or we can say the concomitant symptoms. Okay. So, in homeopathy, sometimes, you find the case bleeding very much, requiring a lot of pads and fluid blood, pain in the back, and we say trillium would work. Sometimes it does not work. And then you have to go in detail about what symptom is associated with the menstrual complaints, and then you can cure the case. Sleepiness together with lack of interest, yeah, this is quite a normal symptom. You don't want to do anything. You just want to lie down, lie down, lie down. So this is very common in case of depression. So if you want to answer, I want to answer this question. So I'll be basically having about hundreds of remedies. Again, I tell you, you have to have the cause of sleepiness. That's important. How to approach psoriasis case of scalp with itching and dandruff and discharge comes out. Dr. Asfia. Very, very important symptom. Very, very difficult disease to cure. By the grace of God, I have got good results in this in my clinic. Now, the question comes whether to prescribe on dandruff and itchiness or want to prescribe on psoriasis. If you prescribe on dandruff and itchiness, we have arsenic iodide, we have miserenum, we have vincamina, we have colchicum, cochlearia, we have kalisalf, we have arsenic, we have X-ray, we have a lot of remedies. This would only minimize the exfoliation and the itching and not the psoriasis. Believe me, not the psoriasis. In psoriasis, it is so important to understand the cause. It is an autoimmune disorder. Find out what is hurting the patient, what has hurt the patient. The patient was not able to come out because of that, and because of that, the body is trying to multiply, going to psoriasis. One example I always give in case of psoriasis, elements from dominance, long history of. The patient is dominated for years. He is not able to come out, and the body tries to take out the symptom in the form of exfoliation, itching and dandruff. We have beautiful remedies like folliculinum, lycopodium, sepia, carcinosin. Okay, this is very important to understand. I hope, doctor, you have understood. Okay, so let us go forward. Yes, anyone, any other question? Now see, again, Nitin, there is a financial loss would cause sleepiness. Okay, so let us understand this. Whenever there is a financial loss and the patient says that I want to sleep. So if you combine these two rubrics, there are few remedies which are very, very important that comes to my mind now. First is Rustox, second is Nux Omega, third is Pulsatilla, fourth is arsenic, fifth is Calcarea, Nitramur. These are the remedies that you can think about. Okay. Yeah, so I have new assistant doctors who have joined me, and they were with me in the YouTube live. So they have encouraged me, sir, we will start on Zoom, showing cases and making the students understand. So maybe if they're very enthusiastic and energetic, we can start on Zoom, and I'll discuss some cases, my cases, how I approach, how I've cured those cases, so that it will be interesting learning on Zoom. You can see and we can watch each other. So there are few assistants who have just joined me, who were with me in YouTube live. So they wanted me, because it was their query also, that in Zoom, in our webinar, we can discuss more. So maybe we'll discuss in a Zoom webinar also. So these are the remedies that come to my mind. Let us go forward. Yeah, I hope everybody is with me. Hello, everybody is with me. Elements from financial loss. I purposely told Rustox. Rustox is a remedy which is so misused by us, especially in college days. Lady comes to us with pain. Lady comes to us with pain in the joints, pain in the knees, and most of the time we prescribe Rustox, we prescribe Bryonia, we prescribe Macphos. So whenever I'm treating a case of a chronic disease, maybe 10 years back, of a tumor or a depression or psoriasis, and in the repertory chart, Rustox comes, and I say, oh, Rustox, no, Rustox I have been used so much. How can Rustox cure psoriasis or chronic disease? And we do not prescribe Rustox then. Are you with me? But my dear friend, Rustox is again a very chronic and a constant medicine. I have cured a lot of chronic problems with simple single dose of Rustox also. It is not only for aggression from first motion, and give Rustox for pain in the joints, pain in the muscles, pain in shoulder, pain in everywhere. Of course, it is there, it is very, very important. But when the repertory chart shows Rustox, don't rule it out, because you have been used and abused Rustox so much that you feel how Rustox can cure these complaints. Okay, so don't do that. Okay, yes, Dr. Narendra. This is basically our, in college we have this type of complaints, and this remedies used so much. Mind rubric should consider or not? A very good question. People ask me, sir, do you prescribe on mind? Do you prescribe on physical generals? Do you prescribe on mental generals? I always tell them, when in doubt, go to Hahnemann. When in doubt, go to Hahnemann. Open organ of medicine, open chronic disease. Just read what Hahnemann has told you. That is our Sora. Never miss that. You can get good results by prescribing through mind method. You can get good results prescribing physical generals. You can give anything, but go to Hahnemann chronic disease, and you will get all your answers there. So be with the basics. My funda of homeopathy is be with the basics. Of course, if you get very, very interesting mind symptom, then it's fantastic. Then you can always, for example, that case of menorrhagia or metorrhagia, I prescribe Nux mosquita just by concomitant symptom. Okay, this is how I approach my case taking. Why ED is more common in early 50s? Good medicine. Why it is more common in early 50s? That you have to think about your cases in early 50s. Okay, every medicine is good depending on what you prescribe and how you prescribe. Please tell the solution of gas, bloating, stomach. The solution of gas, bloating, stomach erosion is homeopathy. Take a good case, tell the patient what to eat, diet, regime, and your homeopathy medicine 1 dose, and you will get the results. Okay, so homeopathy is the result. Don't give other medicines. So let us go forward. I hope you are understanding. My answer is quick, to the point, because in half an hour question answer session, I cannot tell you everything, that's why. So let us go forward. Any questions? Which medicine works for? See, Nitin, for me, I will not prescribe for ED like, medicines for ED like Damiana or Lycopodium or Acid Phos or Agnus Cast. I don't prescribe that type. I will take the case, I will get the cause of ED, the whole case taking, the mentals, the physicals, the generals, repertories, thirst, thermals, and prescribe the medicine. So I cannot give you those direct answers. Whether it is at the age of 50 or after 50 or before 50, it hardly matters unless your medicine is right. Okay, your prescription is depending on the case taking. Yes. Any other questions? Otherwise, I can tell you also what I something about my cases also. If there are no questions, some questions have scrolled up. So let us go and see one of the case which I have just solved. Now, these elements from financial loss. Whenever you get cases of elements from financial loss, the problem starts where you are. Normally what happens? Most of us in financial loss prescribe either arnica or veratrum or natrum. But in financial loss, think about Rustox, and one rare remedy which I have also very rarely prescribed is sarsaparilla. Do think about sarsaparilla where there is elements from financial loss. Okay, are you with me, everyone? Scalp psoriasis medicine. See, if you ask me medicine for scalp psoriasis, I have already told arsenic iode, arsenic alb, arsenic brome, sulfur, sorinum, miserinum, oleander, vinca minor, lot of medicines. But there has to be a cause of psoriasis. That's what I want to tell you. There has to find out the cause. Like I give an example: elements from dominance, sepia, carcinosin, lycopodium, folliculinum, pulsatilla, staphysagrina. If you get the cause, mental cause, you will be able to cure psoriasis. Okay, it's already half an hour up. So thank you for joining, and I hope you enjoyed as much as I enjoy sharing my knowledge with you. Thank you so much. Until next Saturday. Goodbye.